How's that? All right.
So tonight at night?
Yeah. Ready. Hello, and my name is Stacey Edwards, and welcome to In Step with Tomorrow. Today we'll be talking about a virus that affects African Americans, a virus that affects Native Americans, a virus that affects Caucasians, a virus that affects Asians and Hispanics, a virus that affects the poor, a virus that affects the rich, a virus that affects anybody, no matter who you are or your size, your sexuality, whether you're bisexual, heterosexual, or homosexual. This is something that we all need to talk about, and it's HIV. I have the unique pleasure today to have with me to my left, Alette Wright, who is the Director of Education at Planned Parenthood, and she's going to be our expert today on HIV. Alette, welcome.
Thanks, it's a pleasure. It's a privilege.
Yeah, I had Alette, and I work at NYSP, and I had Alette at NYSP, so that's how I got her to come over here. She did a real good job going over HIV and AIDS with the 10 and 11-year-olds, so I thought it'd be great to have her on the show.
Thanks.
All right, first of all, could you just let us know what exactly is HIV? Because there's a difference between HIV and AIDS.
You bet there is. You bet there is. And HIV is the name of the virus, and it stands for Human Immunodeficiency Virus. It's an equal opportunity virus, as you just talked about. It's a virus that can affect anybody. It's a virus that comes into the body because of a behavior that a person chooses, for the most part. And then there's some different steps in the illness. HIV infection or HIV disease is when a person is newly infected, and then when they go through the first few years of this viral process. And then when we say a person has AIDS, that's when they've moved on to having some of the infections, the bizarre infections, or what we call opportunistic infections, that people with HIV infection die from. It also refers to if a person has fewer than 200 T cells or CD4 cells. We can talk about that a little bit too. So there's a big difference between HIV and AIDS. Lots of people are walking around with HIV and don't know it, Stacey.
Yeah, and I think that's one of the big problems that we're having.
You're so right.
So how does that compare in Montana as to the rest of the nation as far as numbers go?
Okay, good question. In Montana, what we have seen around HIV historically since '85, when we first really started keeping good track of statistics, is that we have the same patterns and trends as the rest of the world. Or the rest of the nation, but we just have them a couple of years later. Okay, so we're beginning nationwide to see a lot of infection in young people. In fact, people under 25 comprise 50% of newly infected individuals in this country in this year. 50%. 25% of new infections are in people under 22. And while we're not really feeling that effect so strongly in Montana right now, 2 years from now we will be. We'll be seeing, more and more of our young people affected with this virus, infected with this virus.
So I think there's a lot of theories out there right now also on how this whole AIDS thing came about.
Yeah.
I've heard a million. From a medical perspective, what is your perspective on it?
We don't know. There's a lot of information we don't have about the origin of this virus. We think it probably originated in some areas in Africa, and that seems reasonable, but there's also evidence to suggest that it's a pretty old virus, that it's not something new. You've probably heard the conspiracy theories, right?
Yeah.
That the government developed this and that. There's no evidence to back that up.
Yeah.
So as far as the origin of the virus, stay tuned. We'll probably have more information about that in the next, 10 years maybe. But it's a new thing. We're only 15 years really into looking at this virus and seeing where it came from and what it's going to do. So there's a lot of information we don't have yet.
See, from what you're telling me, I think right now Montana and Missoula, we're not really having a lot of the problems with HIV and AIDS that some of the larger cities
are having.
You're right. And I think what we need to talk about is some of the misconceptions, because when that does come into play in the community, we need to know, okay, how to deal with it.
Right.
You know, like saliva, kissing somebody or
Right.
something like that, or a kid who has HIV can go to school
Right.
with kids who don't, and
Right.
he's not gonna
Yeah,
He's not gonna catch
he's not
anything.
going to infect
anybody.
any classmates. And it's so important, and I really welcome the opportunity to, to speak on your program about this, because there's a lot of myths and misconceptions. It's not a gay disease. In the beginning of this epidemic in this country, it did affect primarily men who have sex with other men. That was the primary risk group that we were seeing going on here. And then we watched it kind of move out. We watched it move into the populations of people who use injection drugs, and then people who have sex with people who use injection drugs. And it's pretty much becoming an equal opportunity virus, In adolescents and our young people, 43% of the new infection is female. In the beginning of the virus, it was very few women that were infected, and now that's kind of starting to equal out. You don't get this virus from saliva. It's one of the things, as in that class of
Yeah.
5th and 6th graders, and that was great fun. We talked about it would take a lot of saliva in
Yeah.
order to get enough concentration of this virus for it to be transmitted. We have never seen it, to the best of our knowledge, transmitted through saliva.
Yeah.
Okay. So that's not a way that you get it. Kissing does not seem to be an issue. Certainly if a person has a cut in their mouth or something like that, then that moves into the whole other group of body
Yeah.
fluids that do
Yeah.
transmit the virus. And those are blood, semen, vaginal secretions, and breast milk, as we talked about in that class.
Okay.
Other misconceptions, it's a minority disease. Wrong. It's an equal opportunity
It's a
virus.
disease.
Although we are in some of our urban areas seeing minority men in particular disproportionately infected with the virus. I saw a statistic recently that said 1 in 30 African American men, for a variety of reasons, injection drug use being one in big urban areas where that's an issue, but other Native Americans being at risk in their reservation populations or in their urban populations, and it's more and more commonly becoming a disease of women.
Yeah, yeah. But I don't understand. I think we're starting to see cases now where, and you can explain this for us, where somehow, okay, let's say the man is infected, and he has sex with a woman.
Right.
Okay, she doesn't become infected, or maybe she does, and the child that they have isn't it?
Is not.
Yeah. How does that work?
I don't know. I mean, it's
No.
just kind of there's several determinants here, several things that probably have an effect. One of them is where the woman is at in the disease process. So if she's like newly infected and has a lot of virus in her blood and body fluids, then her infant is more likely to be infected either during pregnancy or at birth, where the baby gets a lot of exposure to blood and body fluids. But basically, what we have known in the past is it's about 1 in 3 babies that's born to an HIV-infected mom that has their own virus. But within the last couple of years, they did a very important study on giving women who are pregnant and have HIV, giving them AZT, which is one of the first medications that we saw for this virus. It's an antiviral medication. And women who take AZT in their pregnancy have 2/3 less, again, chance of passing that on to their virus. So if a woman has HIV, she takes AZT, it's maybe a 10 to 12% chance that she'll pass that on. And that was real important information.
Yeah.
We can tell women who do test positive for HIV in their pregnancies that if they take this medication, they're much less likely to have an HIV-positive baby.
Okay. Yeah.
And that's good news.
That
That's
is great
good
news.
news. Yeah.
Now, something we also talked about in the class was there were a few instances where a child was born with HIV and
Right.
somehow his immune system developed a way to defeat it.
Right. That's so exciting. There's one really well-documented case in the literature where they did tests specifically for the virus and not just the antibody on a newborn, and this baby did have his own virus. And they followed the child over several years, and at the end of this period of time, the child no longer had virus in its body. And we don't know why. but we think it's really exciting. And I was at a conference recently, I think May, where a really well-known physician was talking about the fact that we think there's at least 5 other cases that we know of where a baby has been able to get rid of infection. And so there may be something in the child's immune system, there may be something else going on, some factors, but some of these kids may be able to, toss off this virus and not grow up with their own infection, their own virus.
Okay, see that, well, that's going to kind of lead us into the next thing I want to talk about is treatment. Treatment. How does somebody who how's the treatment different for somebody who just has HIV as it is the AIDS?
Okay, that's a really good question. And some of if you've been reading the paper, you've been seeing AIDS miracle drugs and AIDS breakthrough in all these medications, and in reality there have been some incredibly important developments. There's a new group of medications, and they're called protease inhibitors, and they interfere with the virus life cycle at a very important point. So when a person who has infection, their body is out there making virus, this medication can come in and cut down on the amount of virus that's being produced by the body. And so that's been very, very exciting. We're seeing people who've been infected, who take this medication, and the level of virus in their body, which we can measure with some tests, really falls and really drops. So that's sort of this new generation of AIDS drugs, if you will. And there's a lot of speculation on when we should start those with people with HIV. And some physicians are saying we need to start that early on so the virus doesn't have the chance to kind of seed and spread through the body. And then there's the old generations of medications like AZT that I talked about, it's another enzyme inhibitor. It inhibits an enzyme called reverse transcriptase. This is part of the viral life cycle. And then there's a few other medications. But what we're seeing is that if we give people 3 medications, a protease inhibitor and a couple of the old medications, that they're really doing well, and the virus in their body is dropping. So having the virus drop in the body provides people with some protection from those infections that come along later when a person gets AIDS. So we may be able to extend that period of wellness where a person who's HIV positive before they become an AIDS diagnosis, that if they're using some of those treatments, that period of time may stretch out longer. And with people who have AIDS diagnosis, same thing. We're seeing them get better, have fewer problems with other infections, and just generally doing well. And the medications are not without problems, certainly, as all those meds are. Yeah. But it's promising stuff. I don't think we're near a cure. Yeah. In the full sense of the word. Yeah. But treatment has become very promising for people with HIV. And if people have HIV, sometimes they're afraid. It's well, I'm going to die from this virus anyway, so why should I go to a physician and get treatment and care? But just to let people know there's many, many compelling reasons to get in, see that physician, and start getting some treatment.
I mean, I can remember back when I first got here, I took a class, and we talked about this in the class. Uh-huh. So me and a bunch of my buddies began to talk about it amongst ourselves. Then we talked about going to get tested, and it's a scary thing to do.
I know.
It's a scary thing to do.
I know.
And luckily, I've had some opportunities through some of the things that I've done where I had to go in and get tested. Right. You know what I mean? But a lot of people are terrified.
Yes.
And I can understand why.
You bet.
I can understand why, but it's something that really needs to be done if we're going to ever control this disease.
That's right.
I think that may be, you have figures here.
I do, some Montana statistics.
And we're going to go over those. But we have figures here, and we can get a good number. Okay, we know this many people have AIDS. But what the hard thing is about is how many people we don't know.
That's right.
And those people are going out there, they're not knowing that they have
That's
it.
Right.
It's just going on and it's going on.
Yep.
And those are the people I think that we need to get a hold of. I've heard of something that I saw on the news where they were thinking about having or they're trying to get a test, just like a home test, that you could do. Do you know anything about that? I mean, it's something that I heard.
There is a home test, and it's been approved for marketing in a couple of states. And there's some, I think, some real positives about that,
There's some
things,
drawbacks, yeah.
and some things that I have real problems with. I've been doing HIV counseling and testing since the late 80s, and I've been training HIV counselors. I work for the state of Montana and contract and train people to do HIV counseling and testing. And there's a couple of things. One is that, yes, people who may not go in to Planned Parenthood or the health department or the other places we'll talk about, who may not go in and get that test, may go ahead and do that test at home. And it's a finger stick test for blood, okay? And then they send that in. But a lot of us feel that the counseling that goes along with having an HIV test is a really important part of it. That what we can do when a person comes in for counseling is we can talk to them about what they're doing to put themselves at risk. You know, maybe it's a man who's tried condoms a lot of times and never had much success with them, and then maybe they've broken or failed on him. Or a woman who's not had very good luck talking to a partner about using condoms.
Yeah.
So when they come in for that counseling, we can kind of connect with them on one-on-one and say, you know, what's going on for you? What's getting in the way of you protecting yourself? And we can find out what things they might have done in the past to put themselves at risk, and then we can take that test, draw that blood, and then they come back and see us when they come back for their results, so we get another chance to talk with them. And that's missing in
Yeah.
this home test
Yeah,
thing.
in the home-
You
yeah.
know, that's not a part of it. And you know, a lot of people disagree with me. I've had a lot of conversations with my colleagues about the pros and cons of home testing. I guess I'm committed enough to the counseling aspect of the test that I really feel that it's important.
But I mean, I think I can speak personally that if I had, you know, if I had it, I would like to have somebody beside me,
Yep.
walk me through this,
You
because that's a, that's a tough ticket to
Yeah, absolutely.
to take from anybody. And I think a lot of people also feel, I have HIV, they feel it's not the HIV that's going to kill you, and it's not necessarily the AIDS, if I'm correct. It's like the cold that you catch, or pneumonia, or
Right.
or something, isn't it?
It is. You're exactly right. It's the kind of infections that a person with a healthy immune system can fight off. And when that immune system starts to go down, then there's other kinds of bizarre infections. There's pneumonia, pneumocystis pneumonia, which 80% of the people in the first wave of this epidemic died from. What we've learned in the meantime is we can prevent that illness with a very simple, inexpensive medication that people take it every day. But it is those infections that can kind of take over the body once the immune system goes down that people die from. So when you read in the paper, died from AIDS, that's not so accurate.
Yeah.
It might be more accurate to say died of an AIDS-related illness.
Yes,
Yeah.
Yeah, I think there are also people out there who are trying a lot of odd things, like with monkeys. I saw one show where baboons fight off the disease. So one man tried to put
Baboon
the
marrow.
bone
Marrow from baboons.
Yeah, and how's that?
It didn't have
Any
the
effect?
hoped-for results.
Yeah.
But the man had a lot of courage,
Yeah,
in my opinion, because he's pretty ill and didn't have a lot to lose
Yeah.
as far as he was concerned, and he was willing to kind of make that leap and give that a try. And the thing about simians, monkeys, they do have a very similar sort of virus,
Yeah.
and it's called simian immunodeficiency virus, or SIV. The difference between humans and those simians or primates is that they don't get sick from the virus. They don't get ill. They don't become infected with other diseases. So there's a lot of information to be gained from doing some of that kind of research. And unfortunately, for that man who just had so much courage,
Yeah.
that wasn't helpful.
Yeah. Yeah.
But bless his heart for
Yeah,
doing it.
yeah, I mean, you can't fault anybody for trying. I mean,
That's right.
You look out there now. I mean, and you can actually see how it's affected, everybody over the years with Magic Johnson.
Yes.
You see the boxer Tommy Morrison.
Right.
Now having it, and I think in the times to come, there's going to be a lot more people
Yes,
like
there
that
are.
having things, and so. With people like that are up in the limelight, who have everything going for them,
That's right.
that should let us know that it can happen to us.
Yes.
It can happen to anybody.
That's right.
And there's nothing that you can, do to stop it unless you protect yourself.
That's exactly right.
And that's what so many people, I think, just kind of just let go by the wayside. And I think maybe if there was a lot better HIV/AIDS education in the schools,
Yeah.
you know what I mean?
Yeah.
I think maybe we can prevent that, because if we could just get everybody to
Yes.
acknowledge what this thing is, we could probably, get rid of it. But
If they just listened to you
yeah,
and me,
oh,
Stacy,
yeah,
they'd be
exactly.
everybody'd be fine. We wouldn't have a problem. We could just have this all taken care of.
Okay, can we look at or go to some of the figures that you
Sure.
have?
And let's talk a little bit about Montana statistics. And I
Okay.
talked a bit about trends
Okay.
a little earlier. And some of the trends that are alarming nationwide are infection in women, as I mentioned. And as you mentioned, women are more at risk from infection through their male partners than vice versa, partly because of anatomy. The vaginal mucous membrane is larger. It's a big area that's vulnerable to penetration by the virus. And also, if you're looking at the body fluids that transmit the virus, and those are blood, as I mentioned before, I guess, blood, semen, vaginal secretions, and breast milk, there's more HIV in semen than there is in vaginal secretions. So one of the alarming trends that we're seeing nationwide is infection in women, especially our young women. And in Montana, we're seeing that too. It's coming a little more slowly, but I've worked closely with the AIDS Service Organization in Missoula, the Missoula AIDS Council, which provides case management and support group services, that sort of thing. And we're beginning to serve more and more women. So our trends there are starting to come into line, and our trends with young people. But as far as, let's look at who in Montana has AIDS, okay, as distinguished from being HIV positive.
Okay.
We'll talk a little bit about that too. But as far as who in Montana has AIDS, there have been 305 cases of full-blown AIDS in Montana since 1985.
Okay.
And 193 of those people have died. Okay?
Okay.
So 2/3 of the people who have had AIDS in Montana have died. The primary risk factor in Montana has been in men who have sex with other men. That's a population we've seen affected and infected as in other parts of the country. Currently, let's see, it's about 64% of total infection that we have in Montana. We have infection with minorities. Okay, our Native American population is infected at about 7% of our totals, which is pretty much in line with Native American population in the state.
Okay.
It's about 7%. But I think that's maybe a little bit deceptive.
Okay.
Because we know that prevention is definitely an issue in those communities, and we're not really good at doing that.
Yeah.
Young people, let me talk about that for a minute. What we see in Montana and have seen for the last few years, and we're talking about full-blown AIDS, okay? And that means that people have had this virus for 10 to 12 to 15 years, okay? Before that time, until they start getting sick or until their T4 cells start to fall, we call it HIV infection. But with AIDS, about 25% of people who have AIDS in this state are between 20 and 29. What that means is that those people were infected in their teens.
Yeah.
So that's just so right there. It's like, okay, we're seeing this.
Yeah.
Our young people are at risk. Recently, I did a conference in April on women with HIV. We're just seeing that. I'm seeing more and more newly diagnosed women who are younger, and men as well. So just watching that trend turn to younger and younger people in this state is a frightening thing to me. And when we look at full-blown AIDS cases for people in Missoula, this is a little bit deceptive too. This says that we have had 40.
Okay.
In reality, it's been a lot more than that. A lot of times people will come into this community with an AIDS diagnosis, and they don't come to us for services. This is basically folks who've come to us for services.
Yeah. So
So
the number could be much larger.
That's
and
right.
it probably is larger.
Right, it is.
Yeah.
I know for a
Yeah,
fact it
yeah.
is. But this is the number of folks who are living or have died from, as far as the state statistics go. But now let's talk about people with HIV
Okay.
as opposed to people with AIDS. There have been, let's see if we have this on our sheet, as of June 30th, there have been 512 positive HIV tests in the state of Montana.
512.
512. Okay, we think it's probably between 600 and 800. Just statistically, we can kind of make that
Yeah,
projection.
yeah.
That 600 to 800 people in this state have HIV and don't know it. Okay, this can be a little bit deceptive too because it doesn't reflect duplicates. So if a person's been positive and tested again, it may reflect that twice. But we know, just through the projections we can make, that a lot of people in this state have HIV and don't know it. So they don't know how to prevent it. They've never been tested. They're probably terrified to be tested, as
Yeah.
we just talked about before.
Yeah.
And how do you walk in to a place and say to someone, these are my risk behaviors, I've had unprotected intercourse, or I've shared injection drug works. As we talked about in that class, sometimes it's not people shooting heroin or cocaine or street drugs.
Yeah.
It might be people doing steroids as part of their athletic programs. So we know that it's here. We know that it's here.
I mean, is there anything that we can that we can do to to make it easier for people to come in or I mean it's kind of something that a person has to make up their mind to do. But I just wish there was an easier system for things.
Right.
I think so many people have the misconception that it's a homosexual disease.
Right, or it can happen to me.
Yeah. So,
somehow or another, it's not going to happen to me. Yeah.
So they don't want to, they don't even want to be bothered with
Right.
it.
One of the most important things we can do is what you're doing right here, right now, which is we're having this conversation, and it's going to be broadcast to some folks that hopefully will hear it and take that to heart. More information, more education, the opportunity to just continue to reach folks is a really crucial part of it. I want to let people know that it's not a terrifying thing to come in for an HIV test. I've done counseling and testing at several facilities, and I train counselors. What would happen, let's just talk about if you came in for an HIV test. Say you came into Planned Parenthood, and we do HIV counseling and testing. A couple other places, I'll talk about that. We do our testing anonymously, which means that we wouldn't ask for your name. We'd ask for a couple of initials. Excuse me. So when you came in, you could give your initials to the person at the desk, and then if I were counseling you, I'd come out and they would point you out to me, and I'd come get you and take you back, and I'd say something like, what brings you in today? What has you concerned? What sorts of things have you been doing to put yourself at risk? We would talk about those, kind of talk about maybe how risky those were, and then we'd go ahead and talk about what you might be able to reduce that risk. Condom use is a huge one. You know that, I know that. Most people know that. It's still something we have a hard time talking about. It's embarrassing.
Yeah.
It might be hard for a guy to say, I've used condoms a bunch, but they always break on me, or never used them, don't know how, or a woman to say, I don't know how to ask my partner, those kinds of things. So we can kind of work with that in that counseling session, talk about that. And we draw your blood and then make an appointment for you to come back in a couple of weeks and get that test result. So there's a lot of personal support in that aspect. It's never an easy thing.
Yeah.
I've never counseled anybody that just sort of took it lightly.
Yeah. I can't imagine anybody.
Yeah. But it's such a responsible thing to do and a courageous thing to do. And one thing I think people really need to understand is we do have some wonderful treatments now that we did not have before. People used to think, why should I be tested? It's not going to make any difference. And now we know that we can give people medications and provide them with support, and they're going to stay well longer.
Okay. So as far as prevention goes, you mentioned condoms.
Right. Correct, consistent use of latex condoms is extremely effective in preventing HIV. There's some information out there to the contrary, but I have some very good supporting research that shows that condom use is so effective. A person needs to use a latex condom. They need to use it from start to finish. They need to use a new one every time, and they need to correctly use lubricants with condoms. You don't want to use Vaseline. You don't want to use baby oil as a lubricant with a condom. You want to use a water-soluble condom-compatible lubricant. And that's our primary first defense. Certainly abstinence or not having intercourse is it's 100%.
100%.
If you're not using drugs.
100%.
That's right.
Yeah.
But for most individuals, we're sexual people, correctly and consistently using condoms is a very, very good thing to do.
Yeah. So any women who may be watching the program, those female contraceptive devices aren't going to save you
Exactly.
from HIV. So don't let that be a misconception
Good.
or a reason to let a male have sex with you
Correct.
without wearing a condom, because that's
Correct.
not going to.
Yeah, the pill doesn't do it, the Norplant, the Depo-Provera shot. None of that stuff provides protection
None of that.
from HIV or other STDs for that matter.
Okay, well, we got not that much time left, so I'm gonna give you a chance to say anything. Is there like a number that they could call, or is there something like that to where they could get in touch with somebody?
Sure, there's a state hotline number, and that number is 1-800-223-6668. Okay, and that's a number. It's in the phone book. You can call information and get it. It's a number anybody can get. It's a place where a person can get anonymous information over the phone, so they can talk to or find out what their risks might be. Can also tell you where to get tested for an HIV test. And let me just briefly tell you a couple places in Missoula. Planned Parenthood of Missoula does anonymous testing. The Missoula City County Health Department, University of Montana, and the Missoula Indian Center. People can go to any of those places and get an anonymous HIV test. And I just encourage testing, and I encourage people to call that hotline, ask those questions, do all that stuff.
Okay, well, we're about out of time. I just pray that the Lord watch over us and give a lot of people the strength to go in and get tested, because it's a serious thing, and we can take care of this if we just take the time, get into ourselves, and trust your heart to go in. There's people like Alette in there that's caring people that's going to care for you. So don't be afraid. Go in and get tested. Let's end this thing. Thank you.
Thanks so much, Stacy.
Thank you. Thank you.
My pleasure.